you need to know nutritionally when it comes to preconception. And the second thing is really nutrition won't help this. So the main things I want you guys to know are there are certain deficiencies that I see all the time. It's B vitamins in people who are currently pregnant, and it's also minerals. So when it comes to preparation, you really want to make sure that you're taking a prenatal with a methylated B. Even if it's very low dose, I strongly recommend you need folic acid, but methylfolate. So it can be 100 micrograms. We recommend prenatals to all of our patients based on labs. But the point being is we definitely need methyl B. The other thing you want to know is clinically, we think you need to start preparing 3 months before you want to get pregnant, or at any point, but technically it's a 3-month cycle with sperm. So sperm regenerates every 3 months. It can become brand new, healthier sperm just based on the nutrients. And it's the same way even with the quality of our egg as females. So when we look at the levels and get all the natural things in, that's how we know we're getting the quality of your egg really healthy. So the main things we want to look at is something called DHEA. This is a hormone that makes that egg super, actually, it has a lot to do with the initial stages of development of baby. The other thing that I really like to say is diet. So when you think about nutrition, guys, it's funny. It's almost as basic. It's pretty basic when it comes to food. You know, you want more whole foods, less packaged. We can tweak and fine tune because a lot of people need more protein. So you want to focus heavily on your protein intake. And you actually want to prioritize that in the morning time, especially because that's going to really start that day and allow you to absorb and uptake your levels to keep you balanced, less blood sugar dips throughout the day. So when it comes to fertility, again, it's going to be our diet. But, you know, truthfully, a lot of the people who signed up for this are considering checking levels or interested in that. And my strong recommendation is, of course, you can do like a Whole30, you know, if you want to do something that's going to give you a huge reset. But we always like to start our patients by pulling out food sensitivities, which a lot of you can test through Everlywell or anything or go through us. But yeah, so that's something I just want to preach to. Like, nutrition really does make a massive difference in the quality of the way you feel as well. So the next thing that we're going to look at after our cute little video plays is a little bit about when we are actively pregnant or if something actually goes wrong. So this is something I want to speak to because, guys, often, unfortunately, you know, as much as it hurts my heart, miscarriages, they happen, you know, and that's something I just want to speak to and I want us all to know about, or at least know what's available to you. So the way we look at this, you know, my come from or my belief is, you know, when it comes to fertility, we want to do everything we can to prepare the body naturally, which means we want to meet all the foundational concerns. Thyroid hormone needs to be balanced. We like that around like a TSH around a 2.5 or lower. So we do this naturally through conversion nutrients. If you're my patient, we likely are dialed this in already or are. But the point being is there's certain things we want to check. Thyroid hormone levels. We also need to make sure hormones are in balance. And we're going to look at that a little further. But what I do want you guys to know is there's oftentimes we just have to tweak your progesterone levels naturally, just a touch. If you're scared or worried something's going to go wrong, often what we want to do is just start by looking at balancing our sex hormones naturally. And then additionally, I keep going back to this, but at the most basic, if you guys can mute yourselves as well whenever you hop on. But yeah, the most basic level, what you want to look for is just going to be anything you can do to restore quality to your cells. So clinically, we look at it as we have pillars of health, and we want to make sure all of these things are getting balanced. If there's a glaring deficiency, even though you're taking great care of yourself, you know, your diet's on point, but let's say you're B vitamin deficient, subclinically anemic, you don't methylate well. That's why I recommend checking before, or at some point, if you know, you unfortunately go through a miscarriage, lose baby, or something happens. And I don't say this out of like shame or like, you know, because I notice a lot of patients go to blame themselves about what did they do wrong? Like what went sideways? What could I have done better? Should I have had my vitamins, my level, this or that? It's not that. And I just, you know, I always want to put that out there because, you know, honestly, since I've had this career, I see a lot of miscarriages in practice. I have a lot of people who come to me who have miscarried for years, so things tighten up and then, they're able to carry baby. But the thing is, when this does happen, I just shed the light on this because of course we want to hold space, love, for this event when it occurs. But the other thing is, the best thing I can recommend to do is, exactly what one of my patients did yesterday. Reached right out. She's like, hey, let's connect up. Can we get a visit in? So we'll just check the levels, do a little dialing here, and just, make sure mom's feeling her best. So that is that one. The other thing I want to touch on is, am I eating enough? This is the biggest thing when we look at the blood work. Actually, I see deficient in protein. So I want you guys to think, like, when you're preparing for pregnancy, you need to really be shooting for minimum half your body weight in protein per day. So if you weigh 150 pounds, we're wanting to get like 75 pounds of protein a day, or 75 grams. And I like to do that through either collagen peptides to help, but then just consuming protein. If you are more plant-based, you need to then research the ways to get protein in your diet so you're hitting your number. And then we validate and verify with blood levels. But the point is, protein turns over as collagen. It builds a really healthy gut lining, connective tissue, and it's there for baby when they're developing and growing. So when we have insufficient protein, God designed the body very intelligently, but what's going to happen is baby is going to leach from your body. So they're going to pull all minerals, all the things from the bones, from the connective tissue, so the baby can be okay. But that leaves you feeling like crap. So whenever you're deficient in protein particularly, and it also can happen with carbohydrates as well, this is when you find you're either pregnant or postpartum and you're walking around feeling just toast, like unusually bad. So what you want to do here is, again, focus on protein and then carbs. It's pregnancy is a very carbohydrate dependent process. So I usually, unless there's a certain presentation, like a gestational diabetes or a blood sugar concern, I'm usually very, very generous with wanting you to get healthy starchy carbs in the diet, like our quinoa, root vegetables, butternut squash, all those things. All right. So just to kind of talk about, and then I'm going to have Alicia share after this, but I just want you guys to know, like, a lot of people come to us saying, is natural care for me, or is this something I should even consider? Or should I just try to get pregnant first, then we figure it out later if we need it? So this is what I like to say is probably my personal criteria from when I think it's for you. If you're scared, you're not healthy enough to get pregnant, which you guys have always heard, like, oh, the emotions. And it's so important for fertility that you're not stressed out. And then that is very stressful in its own right, hearing that. So what you want to think about is, if you are someone who knows you're running stressed, you're concerned, it is good. I recommend get a visit on the books with somebody, or just start to get into the place where you're getting information. Because once you have the data and the information, I have never had a new patient visit where someone didn't leave saying, oh, okay, I can take a breath. Like, they're very relieved typically, because and it's usually quite empowering, because often our biological responses, like craving sugar or just needing energy, is because there's a deficiency underneath, and we see it very clearly. So we support that, and then the other things resolve or begin to. So what we want to look at here, if you're worried, it could be a good choice for you to do something to prepare mentally, because it helps. If you feel like you're doing well but not sure, I have a lot of people who just want to check levels. So that's another thing that this can be very helpful. Information overload. So I have a lot of people who say, you know what, everyone's like, you need to do this, you should be eating these foods, these are the fertility foods, why don't you need to do this type of exercise. And the truth is, every single person is different. There's some commonalities, like, with pregnancy, very important for protein and B vitamins to probably be taking more than you think you need, because that does appear to be chronically lower in most. But if you're getting information overload, we can tailor these things very specifically, right down to the exercise you need, the levels of rest you need, based on what we see biologically, and then the exact vitamins, hormones, and such, natural, of course, but things that can help. The other thing is you want someone to listen to you and respect you for your choices and where you are. So we get a lot of patients who are either considering IVF, considering something called IUI, which is an insemination, or they've had, maybe 3 to 6 months. Clinically, 6 months is the marker. If you've been trying for 6 months and have not gotten pregnant, that's when we consider, hey, it's a good idea to start reaching out and troubleshooting. But what happens is a lot of times people come in and they say they've been to the doctor, and you just get like gaslit by your doctor. Like, oh, nothing's wrong, or, oh, let's just try this. Let's just do this. And these interventions sometimes are slightly aggressive depending on where you're at or what your needs and your goals are. So if you're somebody who knows you have an affinity for natural, or you're a little more connected to that, I'd strongly recommend to explore it, learn about it, and see, if it's something just like you're doing today. And then you love natural care and want this for you and baby. So not only do we do things where we get you set up for pregnancy, but we also do things where we're going to get you guys prepared for anything that comes along the way. So, for example, severe heartburn. For example, you're experiencing some hellacious morning sickness, which, again, it's not like this for everybody. But the point is, we can do some phosphorus drops. We can do all sorts of things to really, really help you out naturally. So I want to actually come on and have Alicia share at this time. And it's perfect because it kind of transitions us into the final piece of what I want to discuss today, which is postpartum, what you need to think about and what you really need to know. And one last thing I want to add before I have Alicia, I always, as I mentioned, stress plays into fertility. So it is important in this stage in the preparation, you actually want to envision your life, which a lot of people, do this once they're pregnant or or really ready to try, but you also want to begin to make space for baby. So when you think about it, you clean out your closet, for example, you have half a closet open, there's space. There could be space for somebody to move in. There could be space for you to start a whole new wardrobe, but something new can come into that empty space. So when you decide you want to become pregnant, it's also important to match that in reality. So you want to look at your career choices. You want to look at, how much free time do you have? You want to think about, what are your habits like now? Are you going to bed till 11:30 watching Netflix, or, was that going to work with baby? So you do want to kind of conceptually begin to look at these things and then start to what we call as make space, or create, some time for slowdown, time for relaxation, to really prepare the body as well to sync with the next process. All right, so I'm just gonna look at our participants here and get Alicia unmuted, or Alicia, you can unmute yourself actually. But yeah, so Alicia's gonna just, briefly tell us where she was at, and just so you guys can get a story and kind of understand what natural care is about, but then also just from someone's perspective who is brand new to this, because she's been with us for 3 months and we just did her lab rerun. All right, yeah, Alicia, so let us know what your journey's been like.
Hi. First of all, thank you for having me. And I resonate with every single thing that you said. And if I could go back and tell myself 3 years ago, before I had my first child, to do this, I would have done this. And this is the best gift that I have given to myself ever. And the best gift that anyone could give to me is knowledge and just the change that I feel. So
tell us a little bit about also, what I'm remembering when we did your new patient visit, you were really bad energy.
Yes.
Can you tell the people about how that developed though postpartum, if I'm correct? Postpartum, you just had a big shift.
Yes. So I had a really difficult pregnancy with my second child, he's 18 months now. He was colicky, and I had postpartum depression, and I just attributed my low mood, no energy, falling apart basically is where I was at, to the fact that I had a newborn. And it was just like, this is how it's supposed to be. This is how everybody feels because you have a newborn and you're not sleeping. And it just got to the point where I couldn't function anymore. I mean, no energy. And one of my biggest things was, and we talked about this in the beginning, was I just couldn't get out of bed in the morning. I just couldn't. I mean, and I felt like a teenager, and like my mom would have to drag me out of bed because like it was just not happening. And I came at it from a psychological point of view and like what's wrong with me and why can't I get out of bed and like why am I crashing in the afternoons. And I thought that it would get better as I got more sleep and my child got older, but it did not. So I reached out, and I'll never forget, I had the lab work done through my PCP, and he looked at all these levels and he went, well, yeah, your cholesterol's a little high, but like everything looks good. So just let me know what she says. And so my first thought was like, oh gosh, maybe this isn't gonna work. Like maybe everything's fine and this is all in my head. And then we had our lab review. I think it was in April. So yeah, it's been like 3.5 months now. And I just explained everything to you. And you looked at the levels and you said, yes, I see it here. I see it here. I see it here. I see it here. And everything you're saying makes sense. And like this level and this level are low. And that's why you're having such a hard time getting out of bed. And I cried. I was crying. Like you said, I felt so validated. I have never felt more validated by a healthcare provider of like, wow, there is something going on in my body that is preventing me from doing and living the way that I want to live. And I just can't get there because I have no energy and I have such low mood. And it was just incredible. And gave me the first protocol and did that. And we've discussed, my body has reacted pretty quickly. And within weeks, I was like, oh my gosh, I'm just popping out of bed. Like this is.
And we changed your diet quite a bit too, right? Like
yes,
we took out several things. I think she had a lot of food sensitivities.
yes. You said, do you have a sensitivity to gluten? And I was like, no, like I don't think so. I don't think so. And you said, well, just try, being at 75%, the time not having gluten. And I said, okay. And so I did that. And it was about a solid, I think the first week I had no gluten. And then I had like a piece of bread or something the next week. And I was like, oh, like really like gassy and just bloated. And I was like, oh my gosh, I have a gluten issue. And you cut down my sugar. I was eating way too much sugar because like you said a few minutes ago, I was just craving it and craving it and craving it. Like I mean, I was eating so much sugar and you explained that it's so inflammatory and like which I still don't understand how my doctor said everything looks fine when I had levels that were like off the charts, like not even in, the normal range at all. And so, yeah, cutting out sugar was one of the things that you had recommended for getting my inflammation down, as well as the gluten. And that combined with supplements that I was taking. And you were so conscious of the fact that I was breastfeeding and that I wanted to keep breastfeeding. And I'm still breastfeeding now. And I said I have a goal. Like I want to breastfeed into toddlerhood. And you were like, that's not a problem. There's a whole section of things that we can't use because you are breastfeeding, but that doesn't mean that we can't use something else. So that's what you did. And you're so knowledgeable and like giving options, and I do eat mostly plant-based, and when
Oh, that's
possible,
right. Yeah,
yeah, and
that's another thing, right? Alicia was more plant-based, did not eat a ton of meat. And that's something additionally, to understand, like philosophically or what you're doing, we can always work within it. But again, like why she came in, she's curious, hey, where are my levels at? I want to make sure this is okay for me. Is this working for me still? And we were able to really kind of fine tune a program for you where it still honors what you're
yeah,
doing with the breastfeeding as well.
yeah, and I remember you said, you were like, yeah, there are certain levels here that look great considering that you're plant-based, and it was validating to hear that, and it would have been just as validating if you had said, which you said my last visit, you said, I think we really need to get some more protein in you. And you always, are you okay with adding some collagen peptides? Is that okay for you? Not, this is what you have to do. So, and I said yes. So I I feel like an entirely new person, and it's only been 3-4 months, and I feel my postpartum depression has just lifted so much. Um, and I also see a therapist, so it's not just, it's both sides, and I just cannot recommend either you or someone like you uh enough. I can't recommend it enough. I want to shout it from the rooftops and tell everybody. And I think to myself, if I had made these changes and known about this while I was pregnant or before I got pregnant, like how different would my postpartum experience have been from day one, or my pregnancy? Maybe I wouldn't have had such a tough pregnancy. So for people who are not yet pregnant, an amazing time, to get with you, because you don't know what kind of pregnancy you're gonna have. Maybe you're gonna have morning sickness, the entire pregnancy. Maybe you're never gonna feel sick at all. So, you don't know what you're gonna get. And um so yeah, I really, really thank you. And I really cannot recommend your services enough to anyone that will listen to me.
Well, thank you so much, Alicia. And yeah, the reason we really wanted, I wanted you to share today is just because of that, because Alicia is the example to me of somebody who already, like, she was health conscious, you could had a very good grasp already on wellness, but it's someone who really got her life back from just getting a few things tweaked. So that's why with postpartum, especially when you feel like things can be hopeless, really good idea to just consider, running some hormone levels, because there's loads we can do. So yeah, guys, we really have about 15 minutes left. I'm just going to share with you a few more things here on fertility and what to consider. But yeah, so that kind of wraps up postpartum for us. But just to understand, we can run your levels as soon as, we can do it as soon as 3 weeks postpartum if you want to get in that quickly, but typically we do about 3 months. All right, guys, so just a recap here. We have pre-baby. What we said is, right, you can start that right away with nutrition, moving more towards whole food. Oh, guys, if you can mute yourself on the Zoom. So yeah, anything pre-baby, we're going to start now with more whole foods, getting out the processed foods as much as possible. If you do work with us, we're going to, show you exactly how to do that. But for the most part, like, a whole 30 is extreme, but it's going to be, you want to consider more whole foods, something paleo, something along that guidelines. Can fold in grains, of course, if applied, but yeah. And then the other thing is the quality of the egg. So those are the big takeaways. The quality egg takes about 3 months. So that's when it's a great time to just check those levels. And we do run a special lab workup on fertility. So the vitamin levels we're looking are going to be a little different. Pregnancy. So this is another thing. We run a whole different workup when you're pregnant and levels change. So typically we recommend once you get pregnant, it's a good idea. Straight away, we can either work off the blood work your medical doctor ran, or you run through us. And then we just ensure your levels are tightened down. I strongly recommend to get a check to make sure your levels are in line once pregnant. And then postpartum, usually what we do is about 3 months postpartum, we run a fresh set of labs just to ensure hormones bounce back. If you're feeling off, we run a big set. If things are feeling great, we probably just do a little finite tweaking to make sure we have you and baby and, you know, anything you need with breast milk, milk supply, and things of that nature. So, okay, so what we do, you know, again, just inform preconception planning. So everything we do here is custom, just it's, you know, we all start with a lab, but once you get to your new patient visit, it gets very customized. It's all based on your levels, what we find in your lab work, and of course your goals. If energy is not an issue for you, but your energy hormones are low, we will still support the system, but then that depends. If you have a new priority, we might focus on that a bit more. The, you know, food is just, again, I put this in here because I really cannot tell you. I have a patient right now for 3 months, all she did was food and her blood sugar is like balanced. She's really just switched over to whole foods and monitoring her, you know, less packaged things like that. But food is very much key. We can combine with supplements though to really help. So never worry again if you're doing everything you should be for your health. This is a very big thing that can come into our brains when we're trying to get pregnant is, am I getting it right? Like, do I have enough vitamins? Is this going to happen? Are we going to have any problems? But that's something that, again, just, you know, getting information really can help with. And then the other piece, I'd like to speak to emotional work as well, because when we look at fertility, it's, you know, we have nutrition as one pillar. Pillar number 2 we look at is emotional, and pillar 3 is structural. So, you know, we discuss nutrition, but emotional, you want to consider, some of my favorites are called EMDR, or another one is called NET. And these are both working to reduce traumatic responses to situations. So if you, let's say you have a best friend who's been through IVF and it looked really rough for her, but now you're faced with considering doing IVF. That sounds kind of like it could be an emotional situation for anybody. It's a you know, could be triggering because you watched your best friend and she cried on your shoulder. You know, there's so many circumstances. Maybe, you know, unfortunately had a miscarriage or something happened. And every time you go to get your period after you've been trying, your heart's broken because you wish you were just pregnant already. So when these kind of things are happening, I really cannot recommend enough to address the emotional component. So if you have insurance, sometimes you can just get that covered, but talk therapy often, it's good, but EMDR is great because it loosens up trauma. So you want to kind of know what to reach for. There's the third thing is structural. So structural looks at more of the body's physiology from a structural standpoint, like muscles, skeleton. But I believe strongly in acupuncture for preconception preparation, and even during pregnancy can be amazing. So with fertility acupuncture, everybody kind of practices differently, but typically you ramp up your visits closer to your date that you really are ready to try. And then the third thing is going to be chiropractic. That, again, during pregnancy and preconception, the reason these things matter is because we have this spine, right? And nerves are flowing in and out of it. These nerves wrap around and connect to all the glands and organs of our entire body. Even your thyroid has a connection, your stomach. So often when we see somebody has stomach issues, we actually can recommend sometimes go get adjusted at the level of the spine where the stomach is connected. And a good chiropractor will know this. And you can get huge resolution. So the point is you just want a healthy nervous system with everything flowing through a healthy body. So just things to consider. And my favorite thing, I actually really like to go to Groupon and find acupuncturists, chiropractors, all sorts of crazy health stuff. And I just try it off Groupon. And if I find someone I like, then I give them the business. But that's a fun way to kind of explore. So I know this can be hard. Let me tell you a little bit about my story. So with me, what happened actually was I was engaged to my husband, and I noticed I was gaining a lot of weight, and my face, I mean, had like severe textured acne to the point where I would remember when I would get nervous, I'd literally run my hands over the side of my face. And it became like an obsession. I was like, I wish this stuff would go away, but then I would scratch at it when I was in nervous states and it would get red. And I really felt pretty hopeless because at that time I was more in a teaching role, not for nutrition, but I was in the cosmetics industry and people looked at my face a lot. And I was so embarrassed constantly. And plus I was just gaining weight. So I get engaged and then I'm thinking, you know what, why don't I just check my hormones? I married a chiropractor, by the way. So he's already knee deep in all this stuff. So he's like, Steph, let's just check your hormones. So it was really fun when my husband to be ran my hormone test and found I had PCOS. And I was like, great, we're going to get married now and I'm infertile. Like that, I just went dramatic, you know? So, so anyways, I went to the worst place I could possibly go. But what we did was we immediately started treating with herbs. So, you know, there's many protocols we use, but I was doing licorice, chaste tree, white peony, which helps drain out our excess estrogens and testosterone. So I had the full blown thing. I had really high testosterone. I had really high insulin, unbalanced blood sugar. I wasn't yet to prediabetes, but I was getting there. And this is such a cringe moment for me, but I would literally go to Jack in the Box. I leveled up and started going to Chick-fil-A eventually, but to get Oreo cookie shakes after a hard day of work. And I would just like drink them the entire ride until we got home. And then I wouldn't tell anybody I did it. Like I was hardcore. Like I was in a bad stress place. So the point being though, when we got treated, so we do a treatment for PCOS. So I did my herbal protocol, but I also had to do a detox. So a lot of times with a hormone imbalance, we need to start with a detox because your liver metabolizes the hormones. So if we don't reset that, we're often like building on a shaky foundation. I did a detox, completely pulled out dairy. My freaking face cleared up in 2 weeks. The first time I'd ever had smooth skin in like 8 months. I couldn't believe it. And honestly, I was just so hooked at that point. So then I dove in and then that's how actually I quit my job completely. And I went full force into the clinical nutrition world. I got hired on as an educational role. And then, you know, I migrated over to running my own practice. But yeah, so the reason I say this is because I just stumbled in to checking levels and seeing, hey, do we have a healthy body that's ready? But my gosh, if I hadn't, there's this quote, it's a secular quote, but it's from B.J. Palmer, who is a really important person in chiropractic, but he says, you never know how far reaching something you think, say, or do will be to another person. So, you know, it makes me emotional, but my husband stood for me by doing that, introduced it to me. And he was, you know, it was tough on our marriage. Like I'd like be like, oh, it's been a really bad day. I'm just gonna have a little tres leches cake or something. He's like, Steph, you're supposed to be dairy free. And, you know, the point being it was like the support and having someone stand for you through a process. But yeah, totally changed my path. So you never know, guys, you could also maybe become a clinical nutritionist or a clinician 7 to 10 years later. But yeah, and then just to kind of wrap up and you know, just repeat, you know, everything must be perfect to get pregnant. That's definitely a myth. Okay. So, you know, we have loads of people who are getting pregnant without any of this type of stuff. So, you know, I never want to do scare care, which scares you into working with me because you're afraid of something. All I want to do is just present you the info and let you know, how we can use it as a tool. I'm not fueled enough. So these carbs, although if you're morning sick and it's the only thing you can eat, it seems like a good idea, but we're going to teach you the right, you know, all the right things you need based on your levels. Meds are the only way to cure postpartum depression. I have seen, this is probably the number one thing actually that we see postpartum depression. And I have to say, probably 90% of our patients do not end up going on antidepressant. And they're a hair trigger away from it. They're like, whatever. A lot of them are pregnant even, and they're ready. They're just like, I don't care. This is not okay to feel this way. So we have a lot of natural things we can do to balance neurotransmitters that help support healthier serotonin, dopamine production, stress response. That helps a lot with our mood. And then 3 main shifts. Health is a lifestyle is what we really want to embody and take on. It's not health as in you know what, I got to be perfect for these 3 months to get ready for baby. No, it's like, you know what, we do these things 75% of the time, as close to 100 as possible. Some days we're going to, you know, have a little dairy, we're going to have a little gluten here or there. We're not going to take our supplements. We're going to forget something, but, you know, we just want to, I always want to teach you balance. So that is my philosophy. I do not do macros. I do, you know, I'll tell you, hey, we need protein. I can give you a rough guess if you do well with like a really data set of macros, but I really do not encourage excessive obsession over food. So I like us to, I work with, you know, you to find a healthy balance. And this is another thing, even EMDR, a session or two can be great with, if you ever had anything traumatic in life around food, or just anything from like mom or people, you know, we've seen before. Hormone level awareness, this does need to be checked. Cortisol is one of my favorite tests, because that gets so tapped out when we're trying to get pregnant, or we've just been working hard and transitioning. So cortisol, but hormones in general, anyone who is trying to conceive, it's highly usual we're going to do a little hormone panel for you. So hormone panels through us are 150, but I like to run some foundational concerns as well. And those are usually 295. So the both together is what I typically run if we're in conception stages. But at the minimum, I do like to check our foundational concerns. Yeah, and just answers and custom. This is what I have to say. Like if when people sell a course and they're trying to tell you like, this is the way, buy this, do this, and it's this one way, when it comes to hormones, females, fertility, it gets extremely variable. So there's certain things we can do, but when it comes to hormones, that's when you need, I recommend the customization. So, you know, a little bit about us, you know, we do take a completely natural approach at UWOW Nutrition. We're going to give you food-based recommendations as well as supplements. If you don't want to do a lot of supplements, that's fine. We can dwell more in foods, and then we just let you know if we think you need, that's impossible, for example, to eat that amount of folic acid in the diet. So we'll tell you, look, stack a little up. And then healthy hacks, or healthy, you know, just healthy tips for a healthy baby and beyond, because it's about that lifestyle, if you will, of just knowing what to reach for, understanding your body, and you'll really learn your cues. You'll tell once you know, okay, I have the tendency to dip low blood sugar. If I feel X, we must do this now. And it's very informed choice, instead of, should I be low carb? Ugh, I don't know. I want to go low carb because it seems like it makes sense, but I feel so weak. Like, you can just figure it out, you know, we can know. And that's a pretty inexpensive blood test to get that out. So just, you know, so you guys know there's ways to take that off. Most people, they say kind of what you heard from Alicia, but a big benefit is you just feel like you think a little clearer. Maybe life feels like it's a little more easygoing. You see different successes occurring because you're not as worried any longer, not feeling as bogged down. Definitely no more guessing. So we're going to get that dialed in, and then just better energy for family, for yourself, etc. So the way we do work here is we do advanced lab testing. So we start everybody off with an intro call. We triage, we pick your lab based on what you need, and we talk together. You'll either run through your primary care or you'll run through us. If you do go through us, you just pay us directly. We send you a requisition to LabCorp, and you would go ahead, get your lab work ran. We get it back automatically, and then we do your whole new patient visit. And then that's where we go through the entire functional analysis of the lab. So everything is in a significantly tighter range with this type of care. It's not modern medicine where you have to have a bolded lab value to get treated or any attention. So we're looking at a tighter range called optimal ranges. And then after that, we're going to do a follow-up. And then after that, at 3 months, I do recommend we do a lab rerun. Not mandatory, but when it comes to fertility, it takes 3 months to get cellular turnover, okay? So that's why we have that 3-month mark. We typically recommend to prep 3 months in advance because you get cellular turnover, so the egg quality has taken those nutrients in to enhance it. And the sperm as well for the male gets enhanced after 3 months. And then just real quick, you know, some of the main things we use for male sperm are like CoQ10, NAC, turmeric, liposomal are excellent. And then phospholipids. So that's a very restorative type of oil. Evening primrose is one of my favorite for fertility, but you actually give it to males, but it just makes the quality of the sperm even better. But yeah, and And then just, you know, to kind of recap, if you guys ever need anything or want any help, this is me chilling in a shirt here with some nutrition stuff, but you know, we are so happy to help you, you know, along the journey. I always want you to start with us with an intro call, because the truth is, like what we said earlier, not everybody needs the same amount of lab work or needs to spend the same amount of money, I suppose. So it's much easier for us to discuss your care first, because I'm able to triage it and we can figure out where we really should start. And if you have a solid relationship with your medical doctor, we often can leverage that a bit, depending your insurance, to get some lab work ran through that. And then the last thing, you know, this is just talking about what I shared, our lab work that we would run. We do some visits. Our pricing is all on our website as well at oownutrition.com. Pricing page, you can see everything. And then the last thing is just, you know, invite you guys to book a call. A lot of people on this webinar, we work together already. So, you know, we're already engaged in these type of conversations, but, you know, as a patient, and goes for any of you guys, you have unlimited messaging. So if there is anything that you're, you know, wanting to talk through after this, or you're like, hey, can you give my, you know, person a sperm protocol, or what about me? Can I get this? You know, just let us know. We'll send you guys over some stuff. But yeah, on Instagram, we're UWOW Nutrition. So the link is in our bio for the intro call. It's always there. I just added some brand new slots. And then additionally on our website, you can always book an intro call there. And then, yeah, you let us know if you need anything at all. We're so happy to help. I'm so glad you guys could be here today. This is such a, you know, it's a big passion for me, because I just love seeing, you know, like Alicia's case, or even, you know, a patient on here today who she's getting ready soon to start trying. And she's definitely super intelligent, well thought, well planned. And, you know, I'm so glad that she's, you know, just with us currently, because the point is I'm just excited for going to this life stage with her. But at the same time, I think it's really neat. She's actually a clinician as well. So she gets to learn and see, you know, this perspective when we get into this stage of life. So anyways, guys, mwah, I love you all. I really appreciate your time today. And so great getting to, you know, just hang out with you guys for the hour. So anyways, take care. If you want any more info, you can definitely book an intro call. You can check out our website. You can book a call there, or check out the prices. All right, everybody. Bye-bye. Aloha.